Hi guys, today my case study is going to be on hypertension. So the patient is a 55-year-old African American male who presents to the family practice for their annual physical. He reports some vague symptoms such as an occasional headache, dizziness, and fatigue that has been ongoing for the past few months. So the patient, once again, the symptoms, the patient reports occasional headaches, dizziness, and fatigue. He also mentions that his feet have been feeling swollen and he sometimes is having a hard time fitting his feet into some shoes. Patient has a history of obesity with a BMI of 32. He also has a history of type 2 diabetes and hyperlipidemia, with both parents having been diagnosed with high blood pressure. He admits to living a sedentary lifestyle, as well as having a high sodium diet, often eating frozen meals, and cigarette smoking 1 pack per day. On physical examination, patient's blood pressure is 148/92 and 149/94 on recheck. 2+ pedal edema was also noted. The most likely diagnosis for this male is stage 2 hypertension. This diagnosis was confirmed based on the patient's persistently elevated blood pressure readings of 148/92. This meets the American College of Cardiology and European Society of Hypertension criteria for stage 2 hypertension. The patient also has multiple risk factors, including obesity, type 2 diabetes, hyperlipidemia, and a strong family history of hypertension, all which contribute to the diagnosis of hypertension. Hypertension is a chronic condition that's characterized by persistent elevation in arterial pressure due to a combination of genetic, environmental, and physiological factors. In this particular patient, increased sodium intake, obesity, and sedentary lifestyle all contribute to fluid retention and increased vascular resistance, which are both mechanisms in hypertension. Additionally, overactivation of the RAS system and heightened sympathetic nervous system activity further contribute to elevated blood pressure. Now, given the patient's African American ethnicity, his hypertension is most likely also salt sensitive, meaning that increased sodium intake leads to greater fluid retention and blood pressure elevation. This is supported by research that shows that 50 to 60% of African American patients with hypertension exhibit salt sensitivity. This makes thiazide diuretics and calcium channel blockers the preferred line of pharmacologic agents for treatment. To confirm the diagnosis of stage 2 hypertension and assess for potential end organ damage and secondary causes, several diagnostic tests can be utilized. The first test can be an EKG, which would help evaluate for left ventricular hypertrophy, arrhythmias, or ischemic changes that can result from chronic hypertension and lead to cardiac diseases and disorders. Additionally, a complete metabolic panel is necessary to assess renal function, electrolyte imbalances, and liver function, as hypertension can lead to chronic kidney disease and electrolyte disturbances. Elevated serum creatine levels and reduced estimated glomerular filtration rate suggest hypertensive neuropathy, which is a form of kidney damage that can be caused by prolonged hypertension. A lipid panel is also necessary to assess for the cardiovascular risk, as hypertension, as in this patient, coexists with dyslipidemia, increasing the likelihood for arteriosclerosis and further heart disease. If LDL cholesterol and triglycerides are elevated, the patient is at risk for developing coronary artery disease and even more serious stroke. Similar, hemoglobin A1C is often tested to assess for glycemic control because hypertension and diabetes are also often linked together, as in this patient. For this patient, they would be testing to see his control, which a hemoglobin A1C over 6.5% suggests poorly controlled diabetes, which would further exacerbate the cardiovascular risk and hypertension-induced organ damage. Lastly, a urinalysis might be used to determine if proteinuria is present, which would indicate early kidney damage due to the hypertension. To further confirm the diagnosis, sometimes ambulatory blood pressure monitoring is recommended. That is useful because it can help determine true hypertension from white coat hypertension or just high blood pressure from being fearful of medical providers in medical settings. That would provide valuable information on nighttime blood pressure trends, which are strong predictors of cardiovascular risk. If a secondary cause for hypertension is suspected, further tests may be ordered, such as renal ultrasounds, which can identify renal artery stenosis or polycystic kidney disease, both which can contribute to hypertension that might be resistant to standard therapies. The treatment of stage 2 hypertension involves a combination of lifestyle modifications and pharmacologic therapies to reduce blood pressure and prevent complications. So, first, including and adopting the DASH dietary approaches to stop hypertension, diet, which emphasizes low sodium intake, high potassium consumption, and diets rich in fruit, vegetables, and whole grain. Regular aerobic exercise, such as walking, cycling, for at least 150 minutes per week to improve cardiovascular health and reduce blood pressure, as well as weight loss, smoking cessation, stress management, and limiting alcohol intake. For patients with stage 2 hypertension, pharmacological therapies are often required in addition to these lifestyle changes. First-line antihypertensions include thiazide diuretics, calcium channel blockers, ACE inhibitors, or angiotensin receptor blockers. In African American patients, as mentioned earlier, often thiazide diuretics and calcium channel blockers are preferred due to their proven efficiency in lowering blood pressure and preventing stroke. If blood pressure remains uncontrolled despite this therapy, additional agents such as beta blockers or aldosterone antagonists may also be considered. Most importantly, regular follow-up visits are necessary to monitor blood pressure levels, kidney function, and medication side effects. The goal of treatment is to maintain blood pressure below 130/80 to reduce the risk of cardiovascular disease, stroke, and kidney damage. And with proper adherence to treatment and follow-ups, hypertension is typically effectively managed and can improve long-term health outcomes.